Hey guys, welcome back to the channel where I cover missing persons, unsolved cases, crime news, and more. Well, originally, yesterday, which would have been Tuesday, there was a pretrial scheduled in the Alexee Trevizo case. But it's been put on hold while we're waiting to see if the Supreme Court decides on whether the certain evidence that can be used that the state has appealed, that the judge was able to throw out during the arguments from her defense attorney, Gary Mitchell. So while we wait to see how long that takes, because it's a matter of how much they got going on and how quickly they decide to get this done, there was a piece on Court TV the other night with Vinnie Politan, and I wanted to go through it. Her attorney was on there, and he's had some things to say that I hadn't heard before. So let's go through that.
Trying to figure out what happened inside that bathroom. How does this happen inside that bathroom? Let's bring in our special guest. Joining us, Alexee Trevizo's defense attorney, Gary Mitchell, is with us. Also joining us, forensic psychiatrist, trial expert, witness, and columnist, Dr. Carol Liberman. Thank you both. Gary, I'll begin with you. First, maybe just a quick update on Alexee. Where is she? What is she doing? Is she out on bond?
She is out on bond, and she is attended via Zoom and such. She's got 1 year of college behind her during this time that we've been, and hopefully she attends this fall.
And okay,
but she's at home.
So she's at home with her family and doing school remotely. Let's talk about what happened in that bathroom. What, from your perspective, your investigation, what happened behind that locked door for 18 minutes?
So again, this is her attorney, Gary Mitchell, explaining Alexee's side, allegedly, of what happened in that bathroom that we didn't see.
She gave birth, as best we can tell, and as the evidence indicates, it was a birth that came immediately. She hadn't even had the opportunity to sit on the commode when she started giving birth. The child, the fetus, and the placenta were born almost, not simultaneously, obviously, but within short order of one another. She was in absolute shock, didn't know what was happening. The child was born into the commode. She rescued the child from the commode, placed the child in a sink. The child never moved. The child never opened its eyes. The child never cried. And she has taken a polygraph test and passed it, that in fact happened. Later, she tries to clean up after herself, places the child in the disposal, that's the trash can, and thinking the child had never been alive. And that is still her belief to this day.
Okay, so according to her attorney, she gave birth in the toilet, which I think most of us believe that's what happened. And then she gets it out of the toilet, puts it in the sink. It's not breathing. And yet she decides, instead of asking for help by pulling the cord, hitting the button, opening the door, any of those options, she puts it in a garbage bag, ties it up, and sticks it at the bottom and covers it up with other garbage bags and paper towels, and cleans up, and then she nonchalantly walks out. So yeah, I gotta say, that doesn't sound any better than what I was already thinking.
Dr. Carol Liberman. Go ahead, Gary, you can finish. I thought you were done.
And she leaves the bathroom and goes down to the room where she was at. And all of that's her going to the bathroom and leaving the bathroom are all on video.
All on video. We're watching it right now. Dr. Carol Liberman, put us into the mind of a teenage girl who is carrying a child, and this happens. What are the issues that someone is dealing with at that moment?
Well, first of all, she did know that she was pregnant. Her friends from school have told people that she knew she was pregnant. She was going to name the baby Alex. She even bought things for the child. Clearly she was terrified that her mother would be angry if she had a baby, but she still had a boyfriend. It was unbelievable, but the court allowed her to go to the prom with this boyfriend just not long after. Now, of course, I mean, if
how about in the moment, though, Dr. Liberman? I want to really focus in and zero in on this moment that a 19-year-old is going through this by herself in that bathroom.
Well, first of all, if you watch her going down the hall, we just saw her going down the hall, and she was kind of holding her bottom. She knew even then what was going to be happening, and what was going through her mind. She was afraid to tell anybody. She was, she thought that the best way to handle this would be to pretend that the baby didn't exist. I mean, it was very poor thinking. It was very. I think it was very sociopathic thinking, quite frankly. I know, we can feel sorry for her and all of that, but it didn't have to be this way. She could have told the hospital staff, as you made that point at the beginning, and she could have she told her friends. She went to as a cheerleader with her big belly. I mean, clearly that she was lying to everybody. Well, I mean, except the people she told, but she was lying to everybody.
I agree with her 110%. Everything that she just said, right on the money. Of course, Gary's going to disagree with her in just a moment, but I don't think we're surprised about that.
And she had a boyfriend. I don't know whether she told him or not, but she was going out with him still up until this time and after this time. So this is not how it had to be. I mean, I think she's definitely responsible.
Gary, I wanted to give you a moment if you wanted to respond to anything.
Well, sure. I don't know where information, because it hasn't been disclosed by the state. It certainly hasn't come up in our investigation. And in fact, we've interviewed all of the that she did not know. And I don't know whether this is coming through the internet or some kind of gossip or Facebook or something, but that is not any of the evidence the state has produced or that I produced in this case. There's no such witnesses that she knew.
I don't know. Gary, we're not buying that. Come on. There is no way Alexee did not know she was pregnant. There have been, granted, I agree, it's talk online, it's talk in the community, but people have spoken, not necessarily publicly or letting themselves be known who they are for fear of retaliation and such, but they have spoken out to some of the media, and what have you. They've spoken out online under, anonymous postings and such, that they went to school with Alexee and they knew she was pregnant, and she knew she was pregnant, and she was going to name the child Alex. This has all come out since she did what she did.
Knew, and in fact, our belief is she didn't know at the time. And the hospital knew. They knew almost 50 minutes before she went to the bathroom that she was pregnant, but they didn't tell her. And that's an admission made in court, and the court has found, as a matter of fact and law, that they did not make her aware that she was pregnant, and they did not tell her. So we've already had that hearing.
All right, Gary Mitchell staying with us. Dr. Carol Liberman is going to stand by. When we come back, let's talk about the hospital in all this, because that's my other big question. Did this hospital follow proper protocol? She was in the hospital when this happened.
Well, I was doing triage, but I'm the charge nurse. So she came in, she was triaged as lower back pain, uncontrollable. We were going to give her some PO meds, but the doctor said, no, let's just start a line on her. So we put her in there, gave her some pain meds. She was complaining, so about the pain, and we're like, okay. Then we checked her for pregnancy. She tested positive. So we're like, okay, let's get an ultrasound, make sure, you know what I mean? Then she told them that she needed to go to the bathroom. So she went to the bathroom, and they were trying to get her to come out several times. She wouldn't come out, so they had to go get the keys to open it. And I didn't see it, but they said, dude, there's blood all over the place. She's in there trying to clean it up. I'm like, okay, well, move her in there. I thought she's probably tried to do something to herself because she didn't want to tell her mom she was pregnant. That's what I'm concerned. So that's why we set up to do the transvaginal ultrasound, and the doctor did a vaginal exam to make sure she didn't hurt herself.
So a big question in the case of Alexee Trevizo is the hospital and how this could happen in a hospital. And did they follow proper protocol? I want to walk through a timeline of what happened so you have a better idea of what's happening at what time and in what order. We begin, this is January 26th and 27th of 2023. Alexee first attends school and a 3-hour cheerleading practice. Right, so it's a pretty normal day for her. 11:47 p.m., Alexee is taken to the emergency department and complaining of back pain, ranking it a 10 out of 10. So she's in a lot of pain. 12:05 a.m., Alexee is seen by a physician, and she says she's not pregnant, but needed to have a bowel movement and informed the doctor she was on her period. So that's what she's telling the physician. 12:28, doctors begin administering morphine and lab tests are ordered. At 12:51, the doctors apparently received notice of a positive pregnancy test, and the morphine treatment apparently continues. 1:39 a.m., Alexee informs the staff she has to go to the bathroom. Nurses remove the IV and she runs down the hall. Well, notice that time. This is 1:39. The test results 12:51 a.m. 1:57 a.m. Alexee exits the bathroom after giving birth unassisted. At 2:38 a.m. the infant is pronounced dead. So that's the order of events. But does this make sense? Is this are they doing things right at the hospital? Alexee Trevizo.
I do want to say that the head nurse there, the one we just saw speaking before Vinny had the timeline, that is a timeline that I believe it to be. So I agree with the court TV's, Vinny's team, their timeline that they have up. The question I have is, he states he's like the nurse in charge. I forget his exact title at the moment. And he states that they had the test back and before she went to the bathroom. So I have a little bit of a question as far as from the time, like he said, the time they had the results back and the time she went to the bathroom. Was she actually told or was she not told? So again, I think there's a little bit of question there. And in my opinion, regardless, I completely believe she knew she was pregnant. As far as her mom is concerned, I don't know about mom. I think Rosa may have been in denial, but Alexee knew she was pregnant, and she had many opportunities at that hospital before she walked out of that bathroom after giving birth to be honest. And she chose every wrong option possible that night.
Attorney Gary Mitchell still with us, and now joining us, former emergency room doctor. He practiced emergency medicine for 25 years and was the CEO of MCare, which supported emergency room physicians across the United States. Dr. Angel Iskovich is with us. Doctor, thank you so much. And thank you for all those years you spent in the ER. I mean, so many of us, unfortunately, have been there, and we appreciate it. I want to show you, though, Doctor, the toxicology report and get your reaction to that and everything else that we went through that happened that night. Caffeine, presumed positive. Morphine free, 19 nanograms per milliliter. Phentermine, 420 nanograms per milliliter. What are your thoughts about the toxicology? And what are your thoughts about the way this patient was handled and treated that night into the early morning hours?
Well, it's very interesting and obviously a fairly complex case. And obviously I don't have the ability to look at the charts and all aspects of how care was done. But first of all, in regard to the toxicology, I think that the treatment at times of patients with back pain, even patients that are pregnant and we know are pregnant, giving small amounts of morphine, well controlled in the sort when you're pregnant, even in pregnancy, and in delivery is often done. Obviously, there's epidural blocks and spinal blocks, and even nitrous is used often to relieve pain during birth. So it's not unusual to give small amounts, to give controlled amounts. I can't speak specifically to that toxicology review, but obviously there's a drug there also that's an amphetamine type drug that's for weight loss, which is kind of interesting. Depending how long that was taken, that can have effects on neonates and their development and the sort, depending on the timing of that. And also, of course, morphine, if given over a long period of time, can be cause neonatal abstinence syndrome, where you could have to have withdrawal and the sort. If you've been given morphine, you see patients that are addicted that deliver with that type of situation at times. A few other kind of interesting things, just in regard to the protocol as I understood it. It's when someone comes in with back pain who is of a woman of childbearing age, we by protocol get a pregnancy test. That's a normal case, and that's usually done that if you're trying to examine, for example, the back, assuming that you've been told that one is not pregnant and you don't see signs necessarily of pregnancy that are obvious. You've examined the back. You do this really because you are trying to first assure, before you do any radiographic imaging, for example, CTs or the back and the sort, that isn't in fact the case.
So let me ask you this, doctor. If there's notice of a positive pregnancy test by 12:51 a.m. that's showing up somewhere, and at 1:39 a.m. this teenager gets up, is let out of a room, and goes down to the bathroom by herself, is that sort of an unusual lapse of time between that information and allowing the patient to go down to the bathroom? Because I suspect the people who let her down there didn't know that she was pregnant, or maybe they did.
Well, that's the issue. So, the laboratory testing, if in certain emergency departments you have really quick point of service testing, you can get that test very quickly. If it's done through the regular laboratory, it wouldn't be unusual for that to come back with any other labs over a period, let's say as long as a half hour. So the delay in getting that, it would not be unusual to have that delay. It would not be unusual if someone was in terrible pain to give even small amounts of morphine just to try to make for some relief. That wouldn't be out of the ordinary in that regard. There's the issue of how she's on morphine and unaccompanied goes to the bathroom, for example, after being given certain amounts of depressive drugs. That's something that might be of interest to be looked at in that regard.
All right, I like what this guy had to say. He's he's obviously very knowledgeable, former emergency room doctor. He's going to be careful as he wavers on that particular point, I'm sure. But say that they suspected she was pregnant, and I believe they all did. Anyone who saw her. She was already denying it. She didn't want them to touch her, to examine her, all that, okay? And she said she had to go to the bathroom. Now, granted, looking back now, easily you would have said, well, no. But at the time, would you really, as a nurse, doctor, staff, whatever, okay, would you honestly believe your patient, even if they are being deceptive about that they're pregnant or in denial, whatever, would you honestly believe they're going to waddle down to the bathroom, give birth, well, first of all, give birth in the bathroom, but give birth on the toilet in the bathroom, and then throw it away in a garbage bag and hide it and not tell anybody? Again, there's a lot more to it than maybe the test didn't come back and tell them, before they can get her to get up to go to the bathroom, she was on morphine, which I don't believe any of those drugs that they gave her had anything to do with that poor child, that poor baby dying. It all had to do with Alexee.
From your perspective, where do you think the hospital dropped the ball here?
Well, they dropped the ball from the moment she walked in, because it indicates such. And I'm not just a lawyer. I happen to be a chairman of a hospital and have been in that world for 40 years. You assume that if you have a woman of childbearing age in the hospital and she's complaining of low back pain, you make certain she's not pregnant. I mean, it's a simple test. It came back quickly. It came back on the computers. Every nurse that was taking care of her and the doctor all knew at 12:51 that she was pregnant. They did not tell her. And then at 1:39, they unhook her from the IVs and allow her to go not to a bathroom in her room. They didn't have them in her room.
Down the hallway.
They had her go down the hallway.
I like that, Gary. I'm not just a lawyer. I have experience in the hospitals. Alrighty then. But let's say that maybe they were a bit. I don't believe the hospital was negligent at all, personally. Okay, but let's say that they had some negligence in if they didn't tell her and they didn't keep her from going to that bathroom, unassisted, whatever. Okay, that did not cause the death of this baby. None of their actions caused the death of Alexee's child. Everything that caused the death of that baby was her own mother, the one who carried her for 9 months. It was all on Alexee.
With the nursing staff and the doctor, because they were asking her about her periods, and she said, no, I'm on it right now. I had one exactly 1 month ago. You know what I mean? And then even after they told her that she tested positive for the pregnancy, she was telling her mom, no, I haven't had sex, Mom. I haven't had any sex. I haven't had any sex. That was before she went to the bathroom.
And this is a 20-year-old.
She's 19.
19.
Yeah. So I'm pretty sure, I mean, my opinion tells me that she was pregnant. She knew it. She was scared because of the way her parents are, and maybe the stress of what was going on made her do what she did, whatever she did. I don't know. I can't say that she killed the baby. I just know that she was very deceptive, and she put the baby in the trash can and didn't say anything to anybody, and you know what I mean?
You're right.
And definitely tried to cover it up.
I completely agree with the nurse. And that's the bottom line to me. She didn't tell anybody, and she tried to cover it up. So, defense may have something, I want to put that in air quotes, as you will, may have something as far as the pregnancy test delay and or potentially letting her go to the bathroom down the hall. Maybe. But as far as the entire situation goes, that's all on this person on the screen right here, Alexee Trevizo. She knew, in my opinion, she knew exactly what was wrong with her when she asked to go to the hospital that night. Although I don't know if she had planned when she came in there what she was going to do. That only Alexee knows. But again, she knew she was pregnant. She was in denial to her parents, her family. I believe the boyfriend probably knew. And I think Mama maybe didn't know, but she should. She should have known. I mean, come on. There was got to be signs. She's not having her period, Mom. She's getting bigger, and it's not Big Macs and Whoppers, okay? There's a lot of changes going on with your teenage daughter, 19-year-old daughter, and she has a boyfriend. So, yeah, there's, to me, a lot of issues with Alexee's family, as well as her boyfriend Devin's family, because I believe his mom didn't even look shocked, because I believe she knew as well. But again, that's my thoughts. I believe, but I mean, I don't know. We can't prove that they knew, unless there's some sort of digital evidence like texts and what have you. But Alexee definitely knew she was pregnant. And once that baby came out, if she was surprised it came out in that bathroom, she had many opportunities. Again, all she had to do was open the door and ask for help or pull the cord or hit the button. Every single hospital bathroom has those. That's all she had to do. She just never decided to ask for help, even after she leaves the bathroom. Doesn't say a word. Doesn't say a dang thing. And it's not until the hospital personnel discover her dirty secret, and they have to call law enforcement in, and when they approach her, encounter her in the room, which we saw on the body cam, she's like, oh, what? Yeah. To me, it was not a good acting job. She knew exactly what was in that bathroom trash. She threw away her child. She threw away her child. All right, guys. Again, we are still going to be waiting. We'll see if we get any updates as far as when the Supreme Court takes up the state's appeal. But until then, I hope you have a great rest of the day. And most of all, stay safe.